Hi, everyone. Good afternoon. Happy Wednesday. My name's Mary Kuchenbrod, and I'm going to be talking through some data management strategies, including data seatbelts, what they are and how they can help keep your data safe. So when we talk about data management, when we talk about data safety, we're really thinking about what are the mechanisms that are in place, what are the processes, the tools, the technology, the practices in place that help prevent data crashes, that help prevent something from going wrong, that catches an end user by surprise, catches them unaware, and interrupts their ability to use the data for their clinical workflows, for their analytics, for their care pathways. And so we think about that as being a mechanism that can catch you if something goes wrong. Similar in a car, if you get in an accident, a seatbelt catches you and keeps you safe as the occupant. And just like when we're driving on the road, there are circumstances in our control for how safe we are as drivers. We can control ourselves, but we can't control other drivers on the road. We can't control things like weather. So we have to be prepared for that something could go wrong. We can't buy cars so safe that you wouldn't wear a seatbelt when you're riding in them. And similarly, when you're thinking about your approach to managing data, you can't have a data platform so safe that there will never be a problem with data quality. And so we think about this as what happens if something does go wrong to make sure that your users can continue using the platform uninterrupted. I think about the strategies that you employ for data management as being left of boom and right of boom. So this is a term originally started in the military, where the boom is literal boom. And left of boom, right of boom is what do you do before something has gone wrong? And what do you do in response once something has gone wrong? And this got picked up by cybersecurity. So left of boom, right of boom, before a threat actor has been noticed, in the preventive actions that you do to make sure that you're keeping your system safe. And then right of boom, if in the circumstance where you observe a threat actor, what do you do in response? And I think about this in data management as well. So you have left of boom strategies to prevent an issue from happening in the first place. And these fall into three major buckets. There's preventing human error, which you can do by automating repeatable tasks. You can do by having very clear operating procedures and checklists so that the opportunity for a human to make a mistake in operating that data and manipulating that data is as low as it can be. You also have the understanding of what to expect. What does right look like for this data source? And if the folks who are working with your data don't have that solid foundational understanding of what right looks like, you are more likely to allow problematic data events to take place. You also, in this understanding bucket, understanding changes to data. Understanding if a file format is going to be changing, if a new column is going to be added, if an EHR upgrade is going to occur. Clear communications about changes that are going to happen in advance of the change so that the appropriate preparation can happen is key in preventing data issues. And the last area here in prevention is designing systems that fail gracefully. Because if one row in a file is bad, for example, is the entire file going to fail, or is just that one row going to fail? What is the reaction of a system, and what are its abilities to see data as it's coming in and respond to it in a way that stops data from entering the system or stops data that is correct from being held up? On the right of boom side, and in healthcare data, this is not a rare event. This is an everyday event that something goes wrong in healthcare data. We work with very complex, very messy data. We have a very fragmented ecosystem. So we are responding in right of boom strategies all of the time. And they fall into a couple of buckets. One is detecting when something has gone wrong. So what are your abilities to be constantly monitoring inbound data and looking for churn, looking for unexpected, anomalous patterns in data? And then if you have seen them, how do you contain the issue? And that's what we're going to talk about more today, is seatbelts. Once something has gone wrong, there's some kind of unexpected churn, some kind of anomalous behavior. How do you catch that and keep it isolated so that you're not, going through the windshield? And then the last step is how quickly can you restore the system after failure? Once you have noticed something has gone wrong, you haven't been able to detect it and contain it, it has entered the system, how quickly can you recover back to standard operations? So we're mostly focusing on that right of boom, on that data seatbelt strategy. This is really not a single solution, not a single a set of capabilities, but a library that really needs to be developed around your system and your use cases. So Seatbelts become a useful analogy because we have different types of seatbelts depending on the risk level of the activity. So you might, on an airplane, just be wearing a lap belt, 2-point seatbelt. In a car, 3-point. But if you're going skydiving, if you're putting an infant in a car, you've got a full 6-point safety harness. So there's a spectrum of the amount that you would like, the amount of heavy-handed you'd like to be here, the amount of signal-to-noise ratio that you're willing to tolerate here. But I think about a 2-point seatbelt and sort of an introduction being, let's define some bellwether checks for our data. What are a couple of things that we can measure where if something goes wrong in that measurement, it is likely indicative of a broader issue? So what are those key things to start checking and start measuring? Further advanced is to both expand your library and to start narrowing your tolerance for churn. This might look like measuring the before and after on every single quality measure denominator and numerator every time you calculate your quality measures to have an expected tolerance for the amount that a denominator or numerator should go up and down. Or on the 4-point side, this is really a true operational workaround to a rigorous set of data health checks that are constantly monitored over time. So quality measures is, in many cases, the first use case that I go to, because quality measures have an extremely complex set of relationships and dependencies with the upstream data that goes into calculating a quality measure. It's not just a handful of data elements that go into a quality measure. It is a lot of different data, a lot of nuances, and a lot of opportunities for something upstream to have changed in a way that will change your denominator or your numerator that is calculated in your quality measure engine. So on the starting point, a 2-point seatbelt here is selecting what's a couple large denominator, general population quality measures that really should not have major changes over time. And let's define the maximum tolerance for upward and downward positive and negative change in the denominator and in the numerator. And let's define if that is outside of the bounds of what we expect, what we see in a given measure calculation, stop that measure job. Don't export that new data into the rest of the system. Hold it, evaluate it, understand what happened to cause that unexpected change, and make decisions based on that. You can step up from there. You can start looking at all of the quality measures in the system. You can start to narrow your range of tolerable churn. You can also start to think about varying. Maybe there's a difference between this year's measures and last year's measures. If I'm in January, I'm the beginning of a new calendar year, this year's measures are going to be going all over the place. But last year's measures that I'm now wrapping up my reporting on, I'm expecting much less change there. So I might start configuring the system to really lock down those earlier periods as I go into my incentive model calculations, as I go into finalizing prior year performance. I really want to have very little tolerance for change because any change at this point would be disruptive to my reporting. Versus I'm in January of a new year, lots of things are happening, there's lots of up and down. I'm comfortable with more change and I expect it. We also think about this in our workflow tools. So Assess is one of Arcadia's workflow tools where we're surfacing patients for certain types of clinical activities. And in this case, we're monitoring who are we surfacing and for what, and is that volume following the expected patterns? So is a specific activity that I'm prompting a user for, are they getting the right consistent prompts? And if I see a major change, maybe it was driven by provider attribution, maybe it was driven by a change in eligibility, maybe it was driven by a change to the calculation of risk scores and risk documentation opportunities, whatever that was, if I'm surfacing that to an end user in a workflow tool and they need that tool to do their jobs, a disruption there means an impact to their ability to do their jobs. So measuring the amount of churn in the data that is feeding a workflow tool lets you keep that end user safe, lets them keep using their job. And if you have halted data because of an anomaly that was detected, the worst thing that's happening to that end user is that they're getting stale data, that there's a lag happening, but they are using the latest correct data that you are confident in. We also do this at the extreme 4-point safety level when it comes to claims data. A lot of provider organizations know you get your monthly claims packages from payers, and there can be unexpected changes in the content or in the envelope of delivery of that claims data. And since it's usually a once-a-month exercise, that gives us the opportunity to each month, as that new data comes in, evaluate it, understand what its impact to member months, to PMPM costs are, in advance of deciding to load it into production. So being able to evaluate that data, understand if it is of high quality, if it is going to have an impact to your downstream use of the data before you make the decision on whether to load it or not. And so because this is really a holding chamber where you can have staff evaluate, interact, make decisions about the data, we think about this as a 4-point safety harness because it's a full operational wraparound to that basic churn detection technology. So those are data seatbelts, what they mean at Arcadia, and how we use them to make sure that the users of our data are held safe in the event that there's something that went wrong with their data. We partner with our organizations to continue expanding this library of capabilities as part of our overall data management strategies, which include both preventive, left-of-boom mechanisms to prevent issues before they've happened, and then because issues happen in healthcare data, what we do to detect those issues, isolate them, and recover the system back to normal if they have occurred. Thank you all for listening.